Okay, perfect.
Yeah.
Good morning, Dr. Mel. It's a great pleasure to have you here. And I would like to start asking you about your background. I saw your post also on Facebook. Do you have a Facebook group called the Bioarchitecture or something like that? Tell me something more about it, please.
I'm Dr. Anshul Mel. I have a graduate and postgraduate in prosthodontics. Okay, so once I pass out my post graduation, then I see there is no need of you in the market. So I just go to the market and I visited so many doctors as a consultant doctor, and then I realized that the future going to be on digital dentist. Yeah, so that's how we I jump into that. Then I jump into the clinical now. Then and if everything in my hand, I realize it is not easy. You have to understand the thing, then you can utilize the in your way. So that's how my journey got started. And then clinical cases I'm doing, and same cases we are working backside. Okay, so
Okay,
all in A to Z we are working. So then we realized like these more things you require. Then we got so many answers, and then we start our academy to teach the people. Like
okay,
they want to jump into digital dentistry and how they can utilize every day digital dentistry in their clinic. And
okay.
it is not like that without digital you cannot work, but what it help you out like to solve the cases very easy way, predictable way you can do it. I'm attached with a new face dental clinic. It's a main consultant over there as a prosthodontist, and so many hospitals I'm attached for the prosthetic parts.
Okay.
Especially like we have start from implant or single crown to the end of the replacement of joints. All kind of surgeries we are doing it, and
Nice.
that's how my journey starts from single crown to the all reconstructions parts of the digital
Okay.
dentistry.
And how is India from the dental point of view? I mean, about digital dentistry. It's something that it's already developed. It's something which is already common, or I mean, how many people are, or how many dentists are already digitalized?
So, if I share my experience, na, in initial days, very difficult for me to convince the doctor as a digital dentistry. But some things like some after Corona, like so many doctors attended Zoom meetings and all. So now they realize they are lacking behind. And after that, my digital dentistry in India is growing very faster speed. Okay.
Okay.
Earlier, if I can see my city, only one or two doctor have a scanner. Now, like I can say, more than 500 people are using the intraoral scanner in my city.
500.
Okay, yeah, because see our cities are huge population, so number of doctors also more. So that's how I can see the changes.
I saw on some of your posts that you have intraoral scanner, then you have also facial scanner. What do you think about facial scanners?
See, intraoral scanner only give you upper and lower static positions. Okay, now facial scanner will have help you out to transfer your Facebook. Okay, to the directly software. Okay, so right now if you have only intraoral scanner, you cannot mount. You have to mount in the mean value inside of software. But if you have Facebook, then what we are doing, we are scanning the face along with the Facebook. Okay, so directly we can mount whatever the patient have actually, that we directly mount in a software. So that's how the technology evolved.
So you use the facial scanner and also the traditional
Facebook.
Facebook, and you scan the patient with the Facebook, right?
Yeah, so just before that, I will say you like I have so many patents. So some of the things I have searched in digital dentistry. Among them, there is a one patent in which we have developed the scan body with the Facebook. Like example, you are using any Artex articulator. So my
Okay.
scan body will fit onto your Artex Facebook. Okay, you have to normally you have to attach, and then that scan body you just scan the face. Okay,
Okay.
so that directly superimpose into the articulator inside of software, and directly you can mount in software. So like after this 3D printing, you just place your upper and lower jaw in the articulator. So directly you get the mounting. So there is no plaster or nothing, and you will get predictable result.
How did you acquire your skills? I mean, where have you learned? By yourself or looking the internet, some courses at the university? Where?
Yeah, so that's why I told you, na, like I have jumped in 2014. Only one videos were there, and if I will share my own experience, na, no one is there at that time. Even like the exocad software is not there in India. Okay, so I bought it. Then no one is there to teach me. Then what happened? Like I'm just learning myself, and to fill the form. There's a one page you have to inform like patient name and all everything you have to fill. I spent 1.5 months to like go to the design part. So
Whoa.
everything like yeah, everything learn it by myself because at that time no one is there to teach us. But now like according to like nowadays like so many videos and everything like there onto the net, so like people are learning little bit from there.
And you are not just a prosthodontist. I mean, I saw that you are also very strong in surgery. You are very skilled in surgery too.
Yes, yes. So that's what I'm not that much skilled, but the digital dentistry make me skilled surgeon. Okay, that's how the advantage of digital dentistry. Like if you feel somewhere you are lacking, how to solve that problem, now you can use the digital dentistry. You will get the answer complete. So that's
Okay.
how my skill is improved. Why I'm incorporate my digital dental skill.
Very nice. So, well, Dr. Mel, apart, so you have your clinic side in Surat in India.
Yeah,
Then you hold courses, right, in India, but also abroad. You're right. You
abroad. Yes,
started
yes, yes.
where? I know that you have been also in Dubai, right? And
Yeah.
you have to go also to US, right? Tell me something
Yeah,
more about.
US and Sri Lanka. Then online, I'm teaching to Australia, Italy. So
Oh,
many
nice.
places are yes, yes. So many places are there. But like depend. Like example, in Italy, I have like I'm working for Ruthenium. Okay, Ruthenium Group of Italy. So that they have digital workflow, so they want to show it to them. So we are teaching online. So display that. Even I'm attached with N83 also. So some of the courses we are doing with them also. So like that.
Oh, nice. What is
We
the
are working.
what is the name of this group? Routine, have you said?
Ruthenium, yes, yes.
Oh,
There's
okay. So you
many.
teach
Yeah,
them. Okay, nice.
yeah.
Very
So
nice.
they have one sister branch in like near to my city, 100 kilometer away. So they have developed digital dentures. They are actually working on the acrylics. Okay, so they have make a workflow of digital dentures. So for them also we are doing.
Yeah, yeah. It's a very nice company, big company. I've been there once, well, some years ago, and yeah, they're very kind. It's a very good company. I mean,
Yeah, and then after that, some of the implant brand like Norris and all like
yeah.
they want to be present. Even like Egypt and Kuwait also we are Iran also we are teaching online. So some
Okay.
of the countries like we are finding to go over there. We are teaching some of the people on like over there.
So most of your services right now are more online or live. I mean, live
Yeah.
courses.
Yes. Yeah. So that's what live courses are most common because see online what we can do it like who already doing the things and we improve the work then it is much better. But if someone want to jump into this field for them they have to learn live. Okay, they have to
Nice.
give time to learn the things. If I am teaching online, okay, whatever I am facing, I'm just explaining like how you can do it. Sometimes in live they are actually holding that thing inside of house and I'm guiding like example you are teaching the seeing the video how to drive a car and next day you are start driving the car it is not good if you have a school for that they are sitting next to the and then you are driving it it's much better okay so
Yeah.
that's how there is a difference in between.
I agree. Well, at the moment, so which software are you using right now? So do you use only ExoCAD and ExoPlan? What are the software that you use most in your daily
uh
practice?
to be honest, like main software is ExoCAD and ExoPlan. After that, Blender for Dental. Then so many industry like JewelCAD, SolidWorks, so many things, AutoCAD. Okay,
Nice.
so whenever we want, we are using software. Then Mass Mixer, Geometrics, so many
Oh
software we are
wow.
using. Because see, like as I told you now, there is a difference between only designer and the good designer. So that's we are okay. Good designer when it after the final product in your hand. See, as a clinician or as a patient, you are not seeing how you are manufacturing the crown. Okay, it's like how it's in your hand or how it's inside of mouth. Okay, that's how we are working. So after in your hand, it should be perfectly fit and it look good. So that's how we are different from others. So for
Okay.
we are working everywhere like that.
All right, just few questions. So before we talk about the facial scanner, right? And
Yeah.
you said that it's useful to transfer, the traditional Facebook digitally, in the dental CAD software. Would you recommend this kind of investment, or in your opinion, it's better to invest this amount of money in other kind of technologies, such as
So
I don't know.
yeah, so it depends on what kind of work we are doing routinely. Okay. So example, there is a two option. One is like you are only working on smile design, like you are known for smile design. You are not working on implant based. Okay, only smile design and all. So yeah, definitely it will help you out for the smile design, because right now what you are doing a smile is just 2D. You are not seeing on a side view. Okay, if you have a 3D scanning, you can see a side view everywhere. So the smile design is only not the smile. Okay, you have to see the lateral profile also. That is most important point which is lacking in smile designing right now in market, that you
Right.
can do with 3D scanning. The second thing is like I am also working onto the reconstruction part, like example maxillofacial reconstruction. Okay,
Okay,
so
yeah.
no eye, there is no eye, and also we are placing the implant. Easy to scan the implant, scan body and all. So for that also it's going to be helpful. So as I told you now, when you jump inside of that, then you will find a lot of application of that. Unless and until you are not jump into that, there is no application for that like that. Uh,
I see.
one
And
more thing, one
what do you think about, there are in the past, I know about an iOS app called Bellus 3D, which was a facial scanner using your phone, your iPhone. Do you think that in the future we will use more and more our mobile, our smartphone for facial scanner to plan to design? As you know, do you have the possibility with the ExoCAD, also with the ExoCAD Web View, to see the project with your HTML file? So, what do you think about?
Yeah, so like it's good question. So balance actually all we are using it's already closed, but we are using it. Only problem it gives very small file. Okay, so what we are doing, we just keep a one reference okay over here and then we scan it. So we can scale it like this and like this. So like example, I want to do a Facebook transfer, or I want to do a smile design and all. I can definitely use that data. Okay, only I am not able to use when I am going for the reconstruction part where I want to scan bodies and everything I want to do. Yeah, but future going to be there, because for you there is a good news, as I have just attended our edX in Dubai. So like company are coming with a photogeometric system with the iPad. Okay, so directly you can scan with the iPad your photogeometric system and just immediately you can send, so no need to carry all the gadgets and everything, just you can use your iPad.
How do you see, based on your experience, how do you see digital dentistry evolving in the next years? And if you have any suggestions for other young dentists, to become a better digital dentist?
So I will start my answer with the one good question. It is not a future, it is a present. Digital dentist is a present, not a future. Okay, so right now you have to jump. Okay, not a future, because right now it's already in market. Okay, so that's how
Right.
my answer should start. It's digital dentist is not a future, it's a present, and future is going to be somewhere else, like all AI technology and so many things are going to come. Okay, so they have to go with the present, not a future, not think about future. Now
Right.
there is a present is going over there. So that's how I can finish off my answer for that particular thing
And
topic.
for young dentists, do you recommend to jump directly right now to digital dentistry to find their
Yes.
niche?
Yeah, so like they can jump, but yeah, they should be good with the basic. Okay, basics is must. Even though you are using digital or manual, basic is must. But yeah, I can say by digital they have more advanced things, like some of the things they have not done, but because of digital they have knowledge about that. So ideally, the future, if they are looking for any field in our field, like in dental field, if they are looking, I can say in future, like if you are clinician and if you are digital master, then your digital master more value than the dentist going to be.
Right. Yeah, I totally agree with you. Well, thank you so much, Dr. Mel, for your time. It has been a pleasure, and I hope to meet you soon in person, maybe during a live courses. And I think that we can do very nice things together.
Thank you, doctor. And it's my pleasure to share my knowledge. Thank
Uh,
you.
Okay, bye, bye, bye. Thank you so much,
Bye.
Dr. Mel.
Thank you. Bye. Bye.